website so you can check and see what the topic is and see if it's something you're interested in. If you're interested in joining, there are pamphlets on the back that explain how to join, and if you join, we actually send you a flyer to your door, very old-fashioned, but we send a flyer to you to remind you of the meetings, and you also get in free to all of our events. Speaking of which, coming up next, the next meeting, there's a flyer for the next meeting. We're going to be...
Do I need this? You guys hear
It
me?
will help.
Oh, it would help?
Yeah, it helps record. Yeah, by the way, we do record all of our presentations so that if you want to hear it again or share it with a friend, it's on our website.
Okay, so to me, this is a very exciting topic, but I think to a lot of people it's probably not. So I tried to make it funny. So you'll see on here that I threw in some things that I hope will lighten the mood a little bit. Like Judy said, I came here 2 or 3 years ago and gave a similar talk. Judy came up with this nice title. She thought it'd be a little snazzy. So, you know, there's a couple of things I came up with that I thought, you know, maybe you don't, you know, they don't share very readily with you about assessment. But the truth is that, you know, in that parents book that they give you, the parents' rights book, you know, they do tell you a lot about, you know, what is involved in assessment. It's a little bit technical, but I'm going to try to make it so that we can, you know, so everybody can understand. If you have any questions, feel free to just interrupt me in the middle, it's fine. So I think we'll just get started. All right, there's my beginning shameless plug. So I'm a parent of an adult with autism. Her name's Shayna. Most of you know her. And there we are at her school. It's a residential treatment center. Okay, so there's a couple of things I thought might be helpful to know about testing that maybe they don't put in that book or people don't know just as a matter of point. Although test results come out as numbers, and numbers have meanings, the way we talk about them in a report and the way we talk about them at the IEP and the way that we can use them to help get the child the services that they need, there's a little wiggle room, okay? So that's why assessment's more than just numbers. It's understanding the context of the situation, it's understanding the big picture, the history, the family situation, what the parents want for their child. So although you might look at an assessment report and see a lot of numbers, assessment is a lot more than a bunch of numbers. In fact, I always say that when I have lunch with the kids in the middle of the day, because I keep them for a few days, when I have lunch with them in the middle of the day, I think I get almost better observations and information about the child just sitting and having lunch with them and talking with them than going through all those standardized tests. So it is very important. Like let's say the WISC, right? The Wechsler Intelligence Scale for Children, now on the 5th edition. They'll say your child's IQ is, let's say, 100, okay, which is average. So what does that mean? We're going to go through that. But what I want you to understand is that that's called a composite score. That's like a score for the whole test. But the reality is that doesn't mean everybody got, there's 10 subparts to that test. And that doesn't mean that everybody got average, exactly average on all 10. It means that the average of all 10, whatever they were, came up to 100. So sometimes it's easy for an assessor to say, well, this child has an IQ in the average range. But when you really look at the component parts, it's not the case, and it's not even helpful to say that the child has an IQ in the average range, because the 10 component parts are so varied that the information that you need to get that's helpful, that's where the information is. That's in the detail. That's where you really need to look, and that's why I want people to understand what all the numbers mean. The more educated you are in this whole situation, the more you'll be able to say something that will help the assessment work for you. Sometimes someone will show me a test that somebody else did, and the conclusion will be that this test provided no evidence for the child having an issue. And I'm looking at it, and there's plenty of evidence, but it's in the detail. And if you don't know to look for that, then they brush it over, and you go with them, and then you never got to use it. Now, these standardized tests that we give, the way we get the scores, okay, so the average range, above, below, is because these tests, as they're developed, are given to thousands of kids. And not all these kids have special needs. In fact, most of them don't. The standardization sample, okay, so they'll give it to 2,000 kids in different parts of the country. They're all in typical classrooms. Okay, then we compare our kids' score to the kids of their age all over the country who don't have special needs, who took this test, and then our kids look terrible. And so it's actually not really interesting for our kids to even consider standard scores. You have to report them as an evaluator, but the important thing is to look at the raw score. And the raw score is how many did you get right, okay? So I'll use Elisabetta as an example. Let's say I give Elisabetta a test, and there's, let's say, 10 questions just to make it easy, and let's say she got 3 right. Okay, well, let's say that the other kids, her age, most of them got 6 right, so she's looking pretty bad. But when she takes the same test the next year, she got 5 right. Now, all the other kids her age are now getting 8 right. So what happens is that she did better. She did better. I'm impressed. She almost did twice as well as she did the year before. But because the other kids jumped also, she may look actually worse the second year than she did the first year, when in fact she did better. Do you guys understand what I'm saying? So you always want to make sure the assessor puts down the raw score. How many did the kid get right? Because our kids get assessed so much, at least once a year. And you can compare, and you should compare, but compare how many they got right. Don't get hung up on the standard score. Our kids, most of them, including mine, they're just always in the extremely low range. It's depressing, but that's not where the information is. The information is that they got almost twice as many right this year as they did last year, and that's good news, and that's information we can use towards intervention and treatment, and that's what we care about. Otherwise you could go through a whole report and they'll all say scaled score of 3 in extremely low range, and mom goes home crying, and I know I do it too. But maybe they did better than last year. So call the school's attention to that. Okay, so again, information in the details. Okay, now this next point, I'm making a serious point, but I'm trying to say it in a funny way. When you get in a room with 8 school administrators and the parent, and then say a private psychologist who's done an independent assessment, they have to listen to what I say, but they don't have to do what I say. But it's been my experience that the person with the highest credentials in the room is the one that they end up listening to. And so, just so you know, because honestly, I didn't know this, I don't think I even knew this till very recently. A school psychologist, are there any school psychologists in the room? Okay. Most school psychologists are not psychologists. They've got master's level credentials, and they have a credential as a school psychologist. They've never looked at the DSM, which is, Clarence is like, what? They've never looked at the DSM. They know nothing of diagnosis because school psychologists only have to figure out whether kids are eligible for services for the school. And there's 15 eligibility criteria, and those are the laws they know. And that's where, that's how they're trained. But they don't get any training in the DSM at all. And they only see kids in the environment of the school. When they do an assessment, they may not even meet that they go through the detailed intake and getting to know the family the way a private assessor does. A school psychologist might spend 5 hours testing. A private psychologist would spend like 20 hours testing. So it's a really big difference. And what's nice from my standpoint about the school psychologist is I can talk their ear off because they don't know all the details and all the statistics and and all the intricate meanings. They don't. And also because they work for the district or for the school, there's a limited number of tests they have access to. I can use any test I want, and they probably aren't even familiar with it because it's not one the school allows them to use. It's actually quite frustrating as a school psychologist because a lot of times you can't do what you want to do. And I'm not saying that they're not good. They are good, but they're limited. In Los Angeles Unified School District, you can't even give an IQ test. It's against the law. So here they are comparing how someone's doing in a class, and then they just assume what the person's ability level is. Well, they don't know what the person's ability level is because you're not allowed to give an IQ test. And so that's, it limits them. So it's always good, throughout the years, I've just thrown as much money and time and resources at my child's issues as I possibly can, and I know you all do the same. And to the extent that you can bring somebody in, the highest credentialed person usually wins. It's just my rule of thumb, and so I just wanted to pass that on. Also, you'll also notice that all of your kids have been assessed multiple times, right? The regional center, the district, any therapist the regional center sends in, your medical doctor, the insurance company, the developmental pediatrician, the psychologist, the psychiatrist. Nobody wants to take anybody else's assessment as valid. And I mean, I understand from my perspective, it has to be my assessment. It has to be, I can't take somebody else's word for it because it's my professional, liability and reputation on the line. But, so what happens is our kids get tested a lot and they get really sick of it. And especially for the kids who are higher functioning or older and have just been through it a lot, like, they just end up with bad attitude, not motivated. When is this going to be over? When you go to test them, because it's overkill. So just be careful not to over-test your kids. It's hard on them, and it doesn't always give you additional information. Although I might say something a little contrary to that in a little bit, but just be thoughtful about how many times you test your kids. Does everyone know what an independent education evaluation is? Okay, I mean, I'm going to go over it because I did not know what this was. Apparently, if the school tests your child and you don't agree with the results, you can ask them for an independent assessment. You can say who you want the assessor to be, and the school pays for it. Okay, so that's really nice because that can save you a lot of money. The only downside is time, because they have to do the assessment, then you have to wait, then you ask for the assessment. Yeah, Marcy.
They're not gonna say, yes, we'll pay for it right away. You have to usually use an advocate or attorney
Right.
to get that.
That's right. And so Marcy said that, you know, you need legal help to just ask for it.
Actually, when you ask if they want to deny, I have to bring you to your process.
I'm sorry?
If you ask school district for that, if they want to deny you, they have to bring you to the process, and they cannot just say no.
They can either grant the IEE
Right.
or they take you to due process.
Yes, that's right.
Which they won't.
That's right.
Which is most have a
And the other way to go around it is, if you can, write them a letter and tell them you're going to pay for a private assessment. So you just have to give written notice. Then you pay for the private assessment, and if you end up winning the case in the end, then it is sometimes the case that they will reimburse you for the cost. But again, you need an advocate, a lawyer, you know, like, the whole thing's expensive and tricky and worth it, but, you know, it's a long process. It's a lot of hoops, just like everything is with our kids.
How long is that process usually?
Well, there's timelines, Clarence, about that. So, you know, if they're going to test your kid, they have 60 days to do it. Then they have to hold an IEP. Then you'll disagree. Then if you go to due process, it could be another 60 days until you have your hearing. And, you know, then they have a week or two to make a decision. And so, you know, you could be into the next school year already. It's a shame. It's not in anybody's best interest, but that's the way the system works. But you should know the way the system works, so that the more you know about the way the system works, the more you can play it.
I do have a question though. My question is, okay, the system is set this way. I'm just wondering, what is the thought process from the other side, like the school or the regional center, to set the system this way? I'm just thinking in terms of an IEP. Why do they feel like it's important to do the IEP, and if there's a disagreement, and there's a due process, and 60 days later? Like, I don't understand, what is that thought process?
Just a law.
She's right. Made so that taxpayers' money is used in an accountable way. But I like your question, because you do need to understand it from their perspective, because then you can work within their system. I mean, I honestly think that most of the people who work at the district, you know, they're not there because they're making a lot of money, because they're not. You know, they're there because, you know, because they care. But they have to work within the laws of the system. And if we know their laws, then we can work with our lawyers to try to find a way so they can help us get what we need within their own laws. But it's accountability, it's money, it's bureaucracy. Okay, the other thing I wanted to say about these things that I notice, at least as an assessor, is when your child gets assessed, you get assessed too. And a lot of times they'll give you questionnaires to fill out or ask you questions over the phone. I do it with parents too. Now, in a lot of these diagnoses that we give kids, it has to be present, the symptoms have to be present in a couple settings, in the home setting, in the school setting. And because the assessor isn't going into your home, that's why you're getting these questionnaires. And look, I am the first person to say, my kid, oh, she's an angel, you know? And so, no, she doesn't have this problem or this problem, or yeah, it happens sometimes, but not really, so I'm gonna put never. And so, you know, because there are children, we love them, we think they're perfect, they are, but I can't make an argument to get you the services you need if you underreport symptoms. And it's frustrating when, you know, someone comes and they pay you, you know, they pay you $3,500 to test their kid. Clearly the kid's got issues. I want to get services, and then the parents report nothing on the questionnaires. And like, I gotta have something to work with, you know, and I need data to work with. And you know, if it's happening at school, it's probably happening at home. And so just be careful. I know it's hard because I have the same thing. It's hard to you know, say always, 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 or yeah, a lot, frequently, you know, and then it makes you think about all the problems you're having and how difficult it is. And but in order for me to, you know, to get you what you need, I gotta know what's happening. And so underreporting symptoms is, it's not in your best interest. Right?
Got a question here.
Yeah.
I think I'd go on the other side of where she does everything, but actually I think with a lot of parents it's just, that's your normal. You know, you don't even realize that they're doing, so sometimes I will ask like relatives or friends that frequently visit, you know, if I'm taking one of those questionnaires, what their perspective is.
Yeah.
Because sometimes I just don't see it anymore. I'm so used to, I mean, I'm used to being hit, I'm used to being screamed at, I'm used to elopement. Sometimes it's like, oh, it's not that bad. It's just what she does, you know, so
Right.
that's my normal.
Right.
So I don't, I agree with you, you know, we all wanna, you know, protect our child or paint them in a nice light.
And protect ourselves too.
Yeah,
You're
right.
protecting yourself.
Well, yeah, but also it's, that's your life, that's your normal day-to-day. So sometimes you
Absolutely.
just don't see it anymore.
And I think that you bring up a good point, that those questionnaires are asking about your child compared to typical aged peers, not compared to all the other kids in the special ed class or all your other kids. I mean, I have just one kid, so I relate exactly to what you're saying. I don't know any different. That's the way she is. And that's the way her friends are, so isn't that normal? So, yeah, I hear what you're saying.
I have a question about the validity of the home test given to parents. Recently, currently actually, they're doing a functional behavior assessment for
Yeah,
us. And he's virtually nonverbal, very severely apraxic. And they gave me the BASC-2 questionnaire. Now, about 30% of those questions are questions that you cannot answer by virtue of the fact that the child is nonverbal.
Right.
Does your child say, I'm suicidal? Or does the child say, I'm upset because my classmates tease me?
Right.
And I brought it up to the school psychologist's attention. I said, well, do you have a functional, behavior test designed for kids who are nonverbal? The answer was no. And I was advised to put never to questions that only a verbal child can answer.
Right.
So what does that do to the validity of such a test?
That's a really good question. And actually, it is built into the test to put never when it's not applicable. I mean, because that's what you're saying.
There was no non-applicable, it said never, but.
Right, but
I
so
wish I
when
knew
it's,
the answer of what was going through his brain, but.
but when it's not applicable, the test wants you to put never.
Okay.
And also remember that one test or one questionnaire is never the deciding factor on anything. It's always the big picture. So you know, if all your data is consistent in one direction for a diagnosis, and then one other test is like skewed way off, where did that data come from, that doesn't make any sense, then we disregard it, because it's, I mean, you don't disregard it, but you say, you know, there was, you know, you either ask the parent or you try to figure out what was wrong, but the data isn't always consistent across the board, and you have to decide what's relevant and what, you know, in that case, you know, you'd say, well, the BASC, you know, may not hold the validity that, you know, a test of the child would hold, because the mother couldn't even answer half the questions. So, that's a good question. And, you know, tests like the BASC and other parent questions, those are normed on kids with special needs. And so, you know, there's definitely a part in there for my kid has no ability to do this, so I can't even score it because it's just not even an option. That's a good question.
One quick question. On the third good thing, explain it, because I don't understand.
Yep, and I haven't even gotten to the first good thing to do.
Okay.
Okay, so other things that are good things to know, like he said. So a test can only be administered once a year. That's most tests, okay? And that's because the kids learn the answers and they get exposure to the questions. So most tests you can only give once a year. Now the good news is that there's multiple tests that you can give to measure one construct, like memory or IQ or achievement or whatever. So you just want to make sure that the kid isn't taking the WISC, you know, every 3 months, because it's invalid. And that actually gets a little bit complicated with the process of an IEE, because if the school goes first and they do all their testing, then I go to test. I have to look to see what tests they used. I can't use those tests. I have to use other tests. Then I compare my scores with their scores, but it's not always apples and apples because they're different tests, even though they measure the same construct. So that's why, if you can, I kind of like to go first. So let them backtrack. Let me use the tests I run. Let me get the data that I'm comfortable getting, and then let the school figure out how to use a different test to measure the same thing, because it gives me more leeway to get you what you need.
So do when you do your test, do
Yeah.
they say, well, you've done this test, we're not going to do that test?
No, they wouldn't do that because, again, because to go back to the other point, they don't trust my test. They won't use my testing integrated into their testing because they didn't do it. That's why everybody does it separately, because nobody trusts anybody else. And I wouldn't do it either. If you did testing and you did a memory test and I just was too lazy and didn't want to do one, I wouldn't incorporate the results of your memory test into my data. You know, no way. So that's why everybody does their own thing. Okay, so the third one. Okay, now the third one is really important. I'm testing your kid in one area at one time on one day, and then I'm making a big generalization. Okay, so in the morning on a Tuesday, I gave your kid a memory test. And then, you know, well, what if he didn't eat breakfast? Or what if he wasn't in the mood? Or what if he was upset about something that happened that morning? Or, you know, I mean, so many things can happen. And so as an assessor, we always have to remember that our kids aren't just that snapshot of when we see them, which is why I give out questionnaires to parents and teachers, because honestly, the parents and teachers know the child much better than I do. Even if I spend 20 hours with the kid, they still know them better than I do. And they act very differently with me than they do with their parents and their teachers. In fact, usually they're angels with me for the most part, because it's one-on-one, they get lots of attention, I give them things to eat, we play games, I try to make it fun, and that's different than having to go to school every day and getting pestered by other kids. And So, it's just important, you know, sometimes kids, when I test them, if they do poorly, they'll go, "Oh, I'm so dumb." And, you know, it makes you feel terrible, but you can see how self-concept is affecting how they're testing. They don't even want to try to do something hard because they just think they're dumb. And so it's really important to pay attention to all those little things, and for parents to tell the assessor he's having a tough day, he doesn't feel good. You know, when I test your kids, I want them at their best. I want them to be the best kid that they can be, and if they're sick or they're upset about something, that was right on cue. That was good. Then I can't, you know, I want to say the most valid thing. And so that's why it's important that we have good communication. Honestly, I'd rather you cancel at the last minute than to bring me your child on a really bad day, because I'm not going to get good data, and then I'm not going to say something that's valid, and I can't be hopeful. Okay?
So is that learned helplessness part of, you know, saying they're dumb, or, you know, they want to try?
Well, or it's just a lot of years of I'm in the wrong placement, Clarence. I mean, if a kid's in the wrong placement and everything's hard and they don't understand anything, and they answer 2 math questions and then they can't answer anymore, they know they're not. Or you'll just get out the math and they'll say, "Oh, I'm terrible in math." I haven't even started yet. They've already decided they're terrible in math. So, you know, yeah, it matters. Did that answer your question?
It does, it did. I had no idea to compare it to anything.
Okay.
A question, how do you develop trust in the kid you're testing? I mean, aren't some kids like, they don't want to cooperate with you until they trust you?
Sometimes. Yeah, well, normally when the kid first of all, I meet with the mother first or the parents before the kid even comes in. And, you know, besides getting whole background, I find out from them, you know, what characters does the kid like, what foods do they like, you know, do they respond to sticker charts, you know, what do they like to do? And so then I get all prepared. And so then when they come, you know, I have them come in with their parents the first time for a few minutes, and we all talk, and if they like to color, I give them crayons, or, you know, if they like My Little Pony, I got a whole bunch of ponies, and, you know, so whatever they're into. And then, you know, and then I just tell them we're gonna play some games, and, you know, you're gonna come like 5 times, and we're gonna have lunch together, and, you know, next door there's a therapy dog, and we can, you know, play with the dog at breaks, and, you know, here's the bathroom, and, you know, your mom's gonna be right out here. And some kids separate very easily, it's no problem. You know, other kids, you know, I'll have the parents stay in the room but sit behind the child, so that they're not like giving each other these, you know, these eye communications of, "You did it wrong," or, "Is that right, Mom?" So I'm fine with that too, whatever the child's comfortable with. A lot of testing is just, you just go with it. Some kids are very tough. I've tested kids for hours with their sitting on their parents' laps because they just can't do it. And some kids, it's like the funnest day I ever had. So it depends on the kid, but we talk about it. Okay? Testing is a great thing because you can use it to your advantage to get what you need. And it's my job to help you to do that. And it doesn't just end with testing. You have an IEP, I have to go to that, I gotta argue the point, I gotta make sure you get what you need. And so the more you know about testing, the more you can use it to get what you need. So it isn't just one of those things you just go through and you just another hoop. Testing isn't just another hoop. I think it's an important hoop, and I think that it can really help you get to where you need in the big picture, okay?
Cindy, as an IEE assessor, does the school district give you a limited budget? Do they limit how much you can spend on testing versus parent consultations and school visitation and follow-up and all that?
That's a great question. So what they do is they call me and they say, we have a family who's requested you as an assessor, or we would like to request you as an assessor. And I'll say, what is the scope of the case? And so they'll tell me, you know, the diagnosis or the suspected eligibility, the age, and I'll say, is this someone who's going to be relatively cooperative? Is this someone who can come to my office? Is this someone who I have to go to their school because it's going to be too hard for them to, you know, go out of their environment to test? So we talk about it, and, you know, do you need me to come to the IEP? For how long? Do I need to do psychological testing in addition to educational testing? So is it is the eligibility for emotional disturbance, in which case it's a whole nother kind of testing. So we talk about it, and then we come up with an amount. And that's an amount that they're going to pay me when I'm done, 60 days after when I'm done, actually. And so no matter what happens during that testing time, as long as it's within the scope of the contract that we sign, because we actually signed a contract, then that's how it goes. I've never been in a situation where that's been a problem. You know, it's pretty standard what you do, and you discuss it. Okay. Any other questions? Okay. Yay! My camera's to bake. Okay, so now the rest of what we're going to talk about is more about testing and the specifics of testing and why we do testing, and so kind of that first part of, you know, what they don't want you to know, that's all I could think of. So if you guys have any other questions about that part of it, then we can go into talking about the testing. Okay? Everybody okay? All right.
Quick question.
Yeah.
Usually they put connect with 2 or 3 eligibility on the AP. Right now, you know, they want to put 2 secondary eligibility on IEP. Is that
Oh, a
normal?
secondary eligibility.
Is that normal?
Okay, so there's primary eligibilities and secondary eligibilities. You don't have to have a secondary eligibility, but some kids do. So it's only interesting to use 2 if it gets you services you wouldn't need. I mean, you wouldn't get if you only had 1 that you need, okay? So honestly, I'm more concerned about getting you the services that you need than I am about the eligibility code, because it's, you know, we want our kids to get the help they need. They can call it what they want to. Okay, so why do we do testing? Okay, now you guys probably could come up with a lot of this on your own. So we talked about eligibility. We have a new DSM now, the DSM-5 that came out last May. That's our book of issues that people can have. The school has nothing to do with the DSM at all. In fact, even their autism eligibility is about autistic-like traits. It doesn't even mean that your child has autism. So it's just related to the services that you get, and that's why it's important. But you need to know that what your doctor says and what the regional center says and what the school says are all going to be pretty different. They're not always the same. And again, you have to know their laws, and you have to know where they're coming from and what they care about. Because They don't all care about the same thing. Now, in terms of placement decisions, assessment is important, because are you gonna be in a public school in a regular class, or a more restrictive environment in a special ed class, or a school that's just for special ed kids? Or, my child's in a residential treatment center where she lives there and goes to school there. So, there's all these different levels of restriction, and so placement is very important. It's one of the big decisions in an IEP, and it can change every year. It can change more than one time a year. And so that's one of the very important decisions that assessment helps you answer. And another reason we test is to see if kids are progressing in a certain program or not. So that's why I put response to intervention. So let's say there's some intervention that's going on. We do like a pre and post test, and your child's not seeming to get it and it's not helping, well, then we need to go in another direction. So that's another reason that testing is important. And again, we're gonna look at the raw scores to see, are they getting more right? Not how do they compare to other kids, because we don't really, at some point it doesn't matter. Now when you wanna get, all these different kinds of therapies for your kid, you've gotta justify it, and you gotta justify it through assessment. And so there's lots of help available, but even if I say in an independent assessment that I think a kid has a oral language issue and that they need speech and language services, the school psychologist is still going to do their own assessment to decide exactly what needs to be targeted, even if I did it too. And so assessment is just something you cannot get away from with our kids.
Can we go back to
Yeah.
the third one, the educational therapy?
Yeah.
It involves reading comprehension.
Yeah.
And even some speech, I would imagine, like pragmatic speech or.
Well, kids that have learning differences, educational therapy is often very helpful. So whether the learning difference is in written expression or related to math or reading or oral language, that's a service that some districts will provide to help remediate a problem. And an educational therapist isn't a tutor. An educational therapist is a certified person with a lot of training. It's not easy to be an educational therapist, and the district would rather give you a tutor because they cost less money, but an educational therapist is going to be able to help a lot more because they understand the progression of learning over time.
The social skills group, it's, I've talked about this with our district, but they say that social skills really, the school district's more concerned with any type of services that help with their academics. It's all about academic goals. So social goals are seemingly no interest to them.
Well, I would argue that if you can't interact with the other kids in your classroom, then how are you going to do a group project together? So I think social skills do affect academics. Some schools have like a peer mentoring program or a friends circle, or, schools actually have come up with some pretty creative ways to teach social skills. The regional center also gets involved in funding for social skills if your child's eligible for regional center services.
And she is, and she has it, but I know the school just they close down when I start talking about social skills. Like her one-on-one, was taking breaks during recess and lunch.
It doesn't make sense.
So I'm like, what do you do? That's when
That's
she needs
exactly,
you.
yes, that's
Yeah,
exactly what
she's
she
from,
needs.
yeah, I mean, she knows what to do in the classroom, that's extremely structured, it's non-structured times, and I
Right.
actually had to have that argument, and I'm like, well, come on, you know exactly what I'm talking about. But they're like, our goals are academic, so, so I was interested to see that there.
Actually, I mean, there's some terminology that might help, so it's really educational need. It's not just academic need, it's educational need. So education includes social. So I think that has been the way to think about by the schools for a long time, but more recently, especially with, so many of the kids being on the autism spectrum where social involvement, communication is such a core issue. So, the argument is that social is part of education, which is the goal of the IEP.
Right.
So, I mean, you have to come up with some goals that are educationally important, not academic only.
Right.
I don't know what you think, but these
No,
days,
I think you're right.
academic being the only, it's not.
Sonia's a great person to answer that question. She's,
Well, I mean,
no, you are, you're a great person to answer.
I believe the argument you see, but there must be some way around it because it's
Yeah, I mean,
educational.
I have also, made the point that, the anxiety and the stress from the non-structured activities and not having any assistance with that, she brings that back into the classroom and
No question.
disrupts, and, so that they were kind of buying. But I mean, just even have to have that,
Yeah, it's a
argument.
shame.
So when I saw social skills group, I kind of was like, oh, they do that.
That's something you can ask for. I
Mhm.
mean, and it's
If the
something you
school
should
doesn't
ask for.
provide it, you can ask for an outside service.
Well, and fortunately, Regional Center is now funding something for us, so that's great.
Good.
But I did see that, and I just,
Yeah, sometimes you have to knock at a couple different doors.
yeah.
Can I add something to that?
Of course.
Under the federal law IDEA, the Individual Disabilities Education Act, it provides for preparing the child not just for academics, but also for college and career after high school. So it encompasses the whole child. If the administrators are telling you it's only academics, it's not true. It should be about the whole child and preparing them to move beyond high school and prepare for life, for college or for a career after high school.
And that
So it's-
includes social competence, right?
And that's under the IDEA law, it's a federal law, so it should be about the whole child.
Thank you both.
I had a